the starting point for all of our benefits is our enrollment portal, which opens on Saturday, August 15th. So mark that date in your calendars. You definitely want to go and apply for these benefits. They are free for grad employees working at least 10 hours a week for one semester. And you'll go to the page that I have shared here, hwtrust.geouaw.org. There you'll find the grad employee benefit application on the left. You'll see it's not open yet. It will be open with an active link on Saturday. You'll put in your basic information, and then you have the opportunity to opt in or out of the various benefits we offer. Vision will be the second benefit that you'll see in the list, and you'll be able to select a single plan, a single plus one plan, or a family plan. The single plan is free for all working grad employees. You won't pay anything for that plan. And in addition, the single plus one and family plans are free. That is very unique to our employee group. And it's a great benefit if you have a family. You can enroll your spouse, same or opposite sex domestic partner, and children on this plan for free. So that will be your starting point. You'll get a confirmation email from us once you're enrolled with all of your information, how to use the plan, how to download an ID card, how to find a provider. But we also want to try to answer some of those questions for you today. I'm going to move on to our benefit plan description. Bear with me. There we go. So this is also on our website, and you'll find it under the Vision tab for grad employees. Just some basic things to point out. At the top right is your group number. And with that and your social security number, you should be able to go to any provider and they can access your coverage without having an ID card. Most people don't carry the hard copy ID cards anymore. And so it's really easy having those two numbers to go and see a provider. Starting with the exams usually cost in the range of $40 to $50 or more, and under our plan you'll pay a $10 copayment for an eye exam. Next we'll just talk about frames. Frames work on an allowance basis, and you have a $150 allowance toward the purchase of frames. If the frames are above that amount, two things I want to note about that. We have a new dental plan that has a vision add-on bonus this year, starting September 1. So if you want frames that are above that $150 allowance, you can use that, what's called a fusion benefit under our dental plan to top off that cost up to an additional $150. This is a new benefit this year. It's super exciting. It gives you more access to more frames, basically, that might have been out of your price range before. You would be using your plan year maximum from your dental plan to top off your vision plan. And that's if you know that you don't need a lot of dental work done this year, you're maybe just getting a cleaning, so you can access some of those dollars and get a more expensive pair of frames. That's new this year. Let's say that you don't have or don't want to use your dental plan, your maximum dollars toward frames. You do get a discount over for the balance over your $150 allowance. And it's a 20% discount, is that right, Virve?
Yes, that is correct. So let's say you have a frame that costs $170. After the allowance, the balance is $20. You get additional 20% off that. So your out-of-pocket cost would be $16.
Great. And you, like I said, you could choose to cover that with your dental plan if you chose to do that. Next, you'll see on this benefits description the various lens copays. And for the most part, you'll see that the copay is $10 for most of your most basic lenses. And then as you get more specialized, the copays do increase. There are various lens options that you will see next, and the various copays for those lens options. Recently, in the last couple of years, we improved the plan to make these copayments more accessible and more predictable. So that was a benefit increase that we did a couple of years ago. And then you'll see contact lenses. Contacts and frames can be purchased in the same 12-month period, which is a unique feature of our plan. Not all plans have that option. Did you want to jump in, Virve?
I just want to say that's super unique. We don't see a lot of plans like that, so this is an excellent plan.
Yeah, we just realized that a lot of our members have the need for glasses, and we didn't want to make them choose. So from the very beginning, we allowed both of those to occur in the same 12-month period. And the last thing I want to talk about just from this document, well, to highlight, the contact lens allowance is also $150, just like the frames. Mm-hmm. And the other thing I wanted to highlight is that this plan works on a point of service basis. So it's a little bit different than our dental plan, which works on a plan year basis. The plan year is 9/1 to 8/31, and your dental benefits will renew every 9/1. The vision plan is different, and it works from the last time you access the benefit. Mm-hmm. So if you purchased frames in September 2019, you have access to that benefit again in September 2020. And that's just something to keep in mind. You can always log into the EyeMed website and create an account and see when you last accessed the benefit, just to check up if you're not sure, and to see when it is accessible to you again. All right. That's the basic plan description. Again, it's on our website. And then I wanted to show you briefly the EyeMed website, and a feature that you probably will use more than anything else is Find a Provider. So up here at the top, we have Find an Eye Doctor. You'll put in your zip code and our plan type, and our plan is the Select plan. So that's the network here. We'll take the Select network. Mm-hmm. We'll put in Amherst, and we'll pull up a list of providers that are in network for our plan. Okay, so we'll scroll down here, and a lot of information is on this website. It's super helpful. You can filter this for different things that you might be looking for in terms of languages spoken and location and lots of different options. But what I want to highlight is University Health Services, and this is an in-network provider. It's one of the most popular in-network providers for our members, of course, because it's super close and because they give great service and they're lovely. And that is my introduction for you, Emily Wegner. If you'd like to give us a little bit more information about the UHS Optical Services.
Great, thank you. That was really nice of you. So we've actually been on campus for over 40 years. So we've definitely served a lot of EyeMed patients over that time. So we're really familiar with the plan and how it works. For those who don't know, we're located up on the second floor of UHS. And right now things are a little different at UHS. So everything is by appointment only, including optical services. So that is a change from last year. So we do have plenty of appointments though. We've been holding them for students for when you all come back in the next few weeks. So if you need services, you do want to call because I think a lot of those appointments will fill up fairly quickly. So we do offer eye exams, contact fittings, new contact fittings. We have 2 full-time opticians in the optical shop that's behind me. And we do also have our own in-house lab. So we are able to make a lot of the glasses in-house. So we also have a wide selection of frames. So we do have a lot of frames that fall within the 150 plan limit. And then we also have a lot of designer frames as well, which now sounds like they might be a bit more accessible with the new benefits. So yeah, so I think that's kind of our services in a nutshell. We're open Monday through Friday. We're going to be open 8:30 to 5. Even though UHS is on their website, they're going to be open 9 to 4. So we have expanded hours from the rest of the health service. So just so people are aware. Yeah.
We have one question
Sure.
in relationship to the plan itself. Someone wanted to know so we have a total of $300 in allowance, which is $150 for glasses and $150 for contact lenses.
I would just say it differently instead of adding them together because they don't cross each other. They're not sort of a pool of 300 that is joined together. They're separate pools of money. So there's a $150 allowance for frames and a $150 allowance for contacts. What might be confusing is that now there's this new fusion benefit that is also $150, which you can access from your dental plan, your maximum, and bring it over for materials costs for the vision plan to top up your glasses purchase.
Can it be used towards contact lenses?
It can be used toward all materials costs.
Okay.
Okay.
And let me just also give, it is a reimbursement. So it is not something that your provider will run for you against your bill at the moment of sale, like your like your EyeMed insurance will be applied at the moment of sale in general, and you will pay what you owe under your benefit. It's a reimbursement. So you'll take your receipt from UHS or from another provider, you'll pair it with the reimbursement form, and we have that on our website, and you'll be reimbursed for that fusion benefit.
Mm-hmm.
And actually, Leslie, I just wanted to add one other thing just for maybe a lot of the new GEO members. We do take outside prescriptions as well for both glasses and for contacts. And most contact lens orders we're able to get within a day or two from when we order them. So just so there.
That's great. So Virve, I don't know if you want to jump in and give us a sense of what folks can do if they cannot visit a provider right now. What are their options for using their benefit? And also maybe talk a little bit about out-of-network options for those who might need to access those options.
Absolutely, Leslie. Thank you. Yes. So right now, if you cannot go and visit a provider physically, we actually have 5 in-network online providers that you can, or your benefits will apply automatically. And to mention, they are lenscrafters.com, targetoptical.com, Ray-Ban.com, glasses.com, and contactsdirect.com. And now, obviously, you can utilize all these online providers if you have a current prescription. Now, if you don't, a lot of people, now a lot of places have opened again. I know there's short period of time. Some providers had to close during the first stages of COVID. And right now, just like Emily, your facility has been open now for a month, couple months.
About a month or so. Yeah.
Yes. So I know that, everyone can now again schedule eye exams and go see a provider. But the online options are there for you, especially if you have a current prescription. And again, these are in-network providers. So when you go to the website to use, you just go in, you shop. Eventually, once you have picked your frame and your lenses, they will actually ask you if you're using insurance. You will just say, yes, I'm using insurance. They will ask simple things like your name and your date of birth. And since it's in network, they will find you, and all your benefits will actually apply directly in the shopping cart. So it's super, super easy.
So
yes.
From the landing page, EyeMed.com, view online options is what they're highlighting right now because of, where we're at with the coronavirus. So you click on that and it gives you all
yes.
the online providers that Virve just mentioned. And then my what I've heard from members who have accessed this is that it's super easy when you put in your insurance information
Yes.
to apply your insurance in these transactions. So that's
Yes.
great to hear.
It is very simple and easy to use, and literally you would need your name, your date of birth. You don't need your plan ID. You don't need your social security number or anything like that, especially if you have already registered on the member website. And I highly recommend that you register on the EyeMed's website, because that way you have access to everything that you possibly need. It's like a one-stop shop. You can do everything there. Let's say you had to go to an out-of-network. You can do your out-of-network claim form right there electronically by just downloading the copy of or the picture of the receipt. I mean, we make it super easy to utilize online, or, you know, the member web is like your one-stop shop. I want to mention at this point in time that you also receive you have the contact lens booster, which is additional $20 towards your contacts when you order them online at contactsdirect.com. And Leslie, I can also give you again the flyer. Oh, there it is.
Yep.
Here it is. She's already. Here it is.
It's on the EyeMed tab of our website if you want to access this later. But this is a great, just extra little perk that we have available.
Right. So you have your $150 allowance plus the additional $20 towards your contact purchase. So, and that is at contactsdirect.com. Leslie, should I talk about the Freedom Pass at this point in time? Yep, here we go.
Put it up.
Perfect. So what the Freedom Pass is, this is a wonderful discount that our Target Optical stores are providing to all your EyeMed members. If you go and shop at the Target Optical stores, any frame at any price that they have is zero out-of-pocket cost to you. So basically, I mean, that is a wonderful perk. So let's give you an example. You see a great $120 or $220 Dolce & Gabbana frame, and you have a Freedom Pass. That frame is zero cost to you. So it can be any cost. It doesn't matter. It doesn't have to stay at that $150. It can be any frame, and there'll be zero out-of-pocket cost to you. And all Target Optical stores.
We love our local on-campus in-network provider, and we can't say enough about how we think you should go there, and they're great. But sometimes you're traveling, sometimes your glasses break and you're in California, and these options are really fantastic for that. And also, maybe you're not ready to go out to a provider's office yet, and this is also a great option to exercise during this weird time we're all in. So go visit Emily when you can.
That's right. Leslie, may I add and have you pull up the provider directory or the provider locator again? And I want to point out something that we just added to the lists.
Sure. Should I search?
Yeah, just go, just do the same type of search that you just did, where we can see the providers that are listed. There's a new icon that we have added to all the providers that are following the CDC guidelines for during this time. And I know, Emily, your location is one of them. I noticed that you had that logo.
Safety ready?
Yes, safety ready. Okay. Exactly.
Yes. Great.
So they are already, I recommend if you're at all concerned, visit those locations that are taking those extra precautions to keep everyone safe.
That's great. Thank you so much. I had not noticed that. So
yeah.
Yeah, it's a great thing.
Tita, are there any questions we can answer?
Did you talk about families being added to the plan?
I did, but I can double back on that. So you as the working employee are eligible for the coverage for free, and amazingly, your family is as well. So families that are eligible to add on to our plan include family members, include spouses, same and opposite sex domestic partners, and children. And when you go to our site to enroll, this is actually really important. If you're thinking about enrolling your family, the first landing page of our site, I'll go back. Let me share my screen. We'll have a live link as of Saturday. When you click on that link, it will ask you for your UMASS email address, your student ID, and then it will ask you, are you applying for just yourself or a family? The reason we did that is most people are applying for just themselves, and they don't need to go through all of the steps of the application that we need for families. So it will route you accordingly. So if you are applying for a family, even if it's just for vision, you need to say, yes, I'm applying for myself and a family, and then it will take you right to enter their names and dates of birth. So that coverage is free, again, for singles and families, and it's a great benefit for folks who have families. It's extremely accessible. So the other thing I wanted to highlight is that, remember, if you are a new incoming grad employee, these benefits, the earliest start date is 9/1. And that does require you to apply in August in order to get that start date. If you're returning, you won't see any gap between last year's plan and this year's plan. It will start as of 9/1 and your old plan will end as of August 31st.
And would family members get a new separate ID, or would they have the same ID number as you?
So there are no separate IDs or ID numbers for family members. The subscriber on the plan will be the grad employee who's working, and everyone in the family is listed under that person's name and their social security number and a unique member ID that EyeMed will also assign you, which you can access if you create an account on their site. So if your spouse is going to access the plan, they'll need your social security number and your name, or you can download an ID card from the EyeMed site and give it to them.
And then are there two separate applications for vision and dental, or is it done one application?
All one application. We try to make it as easy as possible. It's an a la carte application. So you'll put in your basic demographic information, your name, your address, your date of birth, and then there are subheadings. Do you want dental insurance? Yes or no. Do you want vision insurance? Yes or no. And it goes down accordingly. So for instance, you can make separate decisions about your dental and vision. You may not want the dental family plan because there is a premium associated with that, but you may want the vision plan for family members because it's free. So you can make separate choices with regard to those two plans.
Someone asked if we exhausted 150 on glasses, but we broke it on vacation and need a replacement. Can we go to Target and get a new frame at $0 even then?
No, since if the member has already utilized their benefits for the year, then no. But if they haven't used their frame allowance benefit at that point in time or their classes, yes.
So
does that answer your question?
If in that scenario, if they had already used their benefit, they could just access the 20% off discount for a second pair of frames. Is that correct?
Actually, it's 40%. It's 40%.
For yes. Complete pair, though.
Correct.
They do have
for
to
complete.
Purchase the lenses.
Yeah, it would have to be frame and lenses purchased for 40% off. Correct.
Okay, that's great.
Technically, also, they'll still have, if they have not used the dental $150, they could use that, but they'll have to pay out of pocket and get reimbursed.
That is correct. If they still had dollars left in their plan year maximum for Emeritus, the new dental plan, they could apply the fusion benefit to the materials costs for new glasses.
How many times can we use the Freedom Pass per plan per year?
So Freedom Pass can be used once. So, but that can be used for every family member. Let's say it's you and your spouse and 2 kids. Everyone can get a free frame from Target, but it only can be used once a year.
And what is the age limit for children who can be under the EyeMed insurance?
It's 19. Any of our presenters have something that they would like to add that we might have skipped?
I think the only thing that came to mind while you guys were talking is that I know a lot of members may not be coming to the area and may have prescriptions on file. So I just wanted to let them know we do ship, and for the majority of orders, the shipping costs are free right now. So I just wanted to let members know they can call and place an order, and we'll ship it out to them as well.
Excellent.
That's excellent. I don't think I have anything else to add. I think.
Someone, do you have a question? Can you use the Freedom Pass or the online discount towards prescription sunglasses?
You can use your benefit towards the prescription sunglasses. So like let me get back to you on that. I would think that you can use it for prescription sunglasses as well. So if you go to the Target store, you find a frame that you like, that's a sun frame, and that needs to, and you can, you want it to be prescription. Yes, it's considered prescription. So yes, you can use Freedom Pass for prescription sun, and your frame will be free at Target.
And then if we use an insurance card, usually where can we go to get that, or is it mailed to us?
If you're a new enrollee, so if you've never had EyeMed before, you will get 2 ID cards that are mailed to you to your home address. And then but we sent them to new enrollees only. So if you have been enrolled with EyeMed before, you can just use your current ID card. And again, ID cards are not needed necessarily. Any in-network provider will find you with your name and your date of birth when you go to that provider's office.
And I just pulled up the page on the EyeMed site where you can log in and create an account. Yes. Which you can then order an ID card, correct, Virve?
Correct. You can, or you can just download it from there. Another really great thing and to have is download the EyeMed app. It's free from the App Store. And once you have registered, your ID card will be automatically in your phone. So let's see if I can log into mine. And all you have to do is shake your app, and it will show your ID card.
Oh, that's great.
Yes, and then you always have your ID card. Our mobile app is great. It also does pretty much everything that you can. It has all the information that you see when you log into the member web online. Your app can show you all the same information. And I have a Touch ID. Let's see if I can log in and show you real quick on the screen. Okay. Touch ID, yes. And now the iPhone 10, the newer iPhones, there's a face recognition too on this app, so it's very quick to get in. Okay, mine is not working. That is not the app not working, it's the user. So I will say log in. All right, let's see if this is working. Oh, anyway, mine isn't working right now. So, but it's really easy. You shake, once you're in the EyeMed app, you shake your phone, you have your ID card handy at all times.
Most of our members tend to not rely on the hard copy ID card just because it's easy to lose and hard to keep track of. And so one of these alternate options, either knowing your ID number and your group number or having it on your phone on the app, is probably more beneficial for you. I will also tell you that there's a function on our portal where you can text yourself your group number. So, which is the only part you should need. You should have your social security number. So that's also another way to access it on the fly if you're at the provider and you need something.
Right. Sorry, my app wasn't working for me. I wanted to show that it's really cool.
No worries.
So someone asked, is this age limit for children new and specific to EyeMed? It was not so in the past. And relate to it, is this age, yeah.
The age limit is not new. It's always been 19.
And to confirm, we can use $150 on allowance for prescription sunglasses.
Yes.
And then if I have a prescription from another optical center that I got in June where my prescription was up, can I use these benefits to refill my contact prescription in September with that prescription once these benefits are active?
Assuming it's a contact lens prescription, yes, you can wait and then utilize your benefit in September. Yeah.
And someone asked, can they get both prescription sunglasses and prescription glasses in the same year?
Well, go ahead.
Go ahead, Emily.
Well, I was going to say one would be at 40%.
Yes.
So typically we would price out, what would be the better pair where you'd have the most savings using your benefit versus getting the 40%.
And then how do we use the text feature?
So if you're referring to the text feature I mentioned, once you're enrolled, so you'll apply for benefits on 8/15, you'll be enrolled in benefits as long as you're eligible as of 9/1, you'll log back into our portal, which is the link to it is in the top right-hand corner of our main website. I'll just show you what I'm talking about right here. So our main informational website is UAW-UMASS-trustfund.org. Top right corner is the enrollment portal. Again, it's not taking you to an active link right now because the enrollment portal is closed, but it will as of Saturday. You'll click on that. It will take you to the application, but it doesn't right now. And once you are enrolled in the benefit, once you are enrolled, you can log back in the same portal and text yourself your group number.
And I guess this question is in relationship to the sunglasses and prescription glasses. Would both would be free if we get them at Target?
Just the frame is free at Target. So frame is no cost. You would still pay for your lenses.
And only one frame.
Yes.
Correct.
For the one
of
frame.
the frames.
Yes.
The second one would be 40%.
Correct. Yes. And the second pair would be 40% off, whichever is greater. Mm-hmm.
And when is something 40% off, as just mentioned?
So after you've used your primary benefit, your $150 allowance, and your eyeglass lens benefit, any complete pairs that you purchase for the rest of that plan year would be 40% off. So if you purchase however many pairs you want of a frame and lenses, all of those would be 40% off.
Mm-hmm. Yes, any additional, there's no limit as to how many you can purchase with that additional discount.
But it has to be a prescription item. If you're
Correct.
purchasing non-prescription sunglasses, then it would be a 20% discount.
Do I have to enroll in August, or can I enroll anytime? Is there an enrollment deadline?
That's a great question. So we have 5 open enrollment periods per year to accommodate grad employees coming onto contracts late in the year. So there's almost always an opportunity to apply. Also, if you have a qualifying event, you can apply at that time. Let's say you had vision insurance and then you lost the vision insurance. Maybe you aged out of your parents' plan. That will also trigger your ability to apply for our benefits. Our open enrollment periods are August 15th to September 15th this year. November 1 to November 15, February 1 to February 15, April 1 to April 15, and June 15 to June 30th. So during this initial big open enrollment period where we try to catch everyone possible so that you have the full 12-month benefit, we keep it open beyond September 1 to try to get everyone in, and that you will have retroactive coverage to September 1. So as long as you get your application in by September 15th, you'll be retroactively enrolled as of September 1. I would encourage you to do it on the first day that you can, on August 15th, because then you won't forget, and no one will be scrambling to get you coverage. You'll just be all set as of September 1.
Where is more info on the Freedom Pass? They don't see it on the plan description.
All right, so again, you'll go to our website, which is UAW UMASS Health and Welfare Trust, UAW UMASS Trustfund.org. You'll go to the GEO tab, down to GEO Vision, and scroll down on the right-hand side. You will find the Contact Directs Booster and the Freedom Pass pamphlets that you can click on and bring up.
And then just for the Freedom Pass, you want to bring that flyer to the Target Optical store. There's a code that they need to use at the point of sale. And it's on the bottom. It looks like Take Advantage. So they need that code when they are, when you're at the point of sale, when you're ready to pay, so that you get your frame for free. So always bring the collateral, the piece of this flyer with you.
So if you were stuck at the store without it, you could always call us and we could text you this code or send you the PDF. All right, if you have subsequent questions, you can email us or call us, uawdental@external.umass.edu. You can go to our website and we'll get your questions answered. Thank you to our presenters. Thanks to everyone who participated today. It was great. Thanks so much.
That was great. Thank you so much.